Hope you're having a great week. Happy Medical Monday here at HealthCARE Express. Continuing along with our allergy theme, we're talking about diseases related to allergies that people have this time of year as pollen, grass, weed, trees start to bloom and allergens are in the air. And for a lot of people, that means it's time to get sick. Outside those normal symptoms you have of runny nose, watery eye, sneezing, sometimes there's other things that go on. Last week we talked about acute bronchospasm and people that have asthma or don't even know they have asthma, or some, you wouldn't classify it as asthma, but some mild breathing issues that flare up every now and then. Allergies can set that off. This week let's talk about something different. We all know you can have runny nose that's clear from allergies and drainage from that, but if you have that continuously over 5, 10, 15 days, up to 2 or 3 weeks, sometimes that can result in an ear infection, especially in kiddos. Now, ear infections are several different kinds and there's several different causes, but from an allergic standpoint, what it means is you basically have fluid that normally should be able to drain freely down the eustachian tube from your middle ear to your throat. It can't, usually because there's some inflammation or some blockage from excessive congestion that you're producing because of your allergy symptoms. So a lot of times kids may complain of ear pain, and kids complain, but adults complain of ear pain all the time related to allergy symptoms and congestion that blocks that drainage that's supposed to happen. And a lot of times the fluid will just sit there, bulge, push the eardrum out, cause pain, cause hearing changes. You feel like you're underwater, you can't hear right. Sometimes it'll even cause people to have balance problems and things like that. We distinguish this from a bacterial ear infection, usually based on the look of the eardrum when we examine you. But what we would call a serous otitis, or basically a clear fluid ear infection, excessive amount of clear fluid behind that middle ear, is often one of the biggest problems with allergies. We can do a lot of things in medicine. We have not figured out a perfect way to pull fluid off that middle ear. So we a lot of times just treat your symptoms, and we'll treat you with appropriate antihistamines or nasal sprays, different types of anti-allergy medications, and even antibiotics if we feel like the fluid is at risk for an infection. A lot of times it's not necessary. Sometimes we just treat the pain with drops or something like that, and people do really well. But a lot of times if you miss that underlying cause of what's actually causing this ear pain, the chronic symptoms, and don't realize that it's allergies, you may go along for a while and treat just the symptoms without actually getting to the root of what's going on. So you start having ear pain and congestion and drainage for 7, 10 days, definitely need to get seen. Don't need to go to the ER. Can't get anywhere you normally want to go, or can't find a great place to go. You need to come to a place like this, to an urgent care center. They'll be happy to take care of you. That's it for this week. Have a great week, and we'll see you next time.